2 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Thank you so much. I look forward to learning a lot. So you're taking care of the patient in room 321. Do you have time to give me a report?
Sure. We have Miss O'Connor. She is a 34-year-old African-American female. She is full status at this time. She came in with fever secondary to end-stage renal disease. Her vitals were done at 7:30 this morning with a temperature of 101.1 Fahrenheit, 95 for pulse, respiration 20, blood pressure 138/78, and oxygen saturation at 96 with room air. She currently has a pain level 4, saying that it's aching. She has a IV in her right median vein, and for her main complaint, again, was fever, chills, and general malaise. She has diabetes type 1 and end-stage renal disease, presented to the emergency room at 5:30 this morning with fever, chills, and general malaise. Patient reports elevated blood glucose readings and decreased appetite for the past few days with minimal urine output for the last month. Patient has history of renal failure secondary to diabetic neuropathy and hypertension, nephrosclerosis. She has been undergoing scheduled hemodialysis 3 times per week for about a year, and she's currently listed for transplant 6 months ago. She does have a drug allergy. It's tryptophan sulfamethasol, and it causes her to have rashes. For family history, both her parents are alive and in good health. Again, previous illness, she has type 1 diabetes that was diagnosed at age 8. She currently has end-stage renal disease that was diagnosed 1 year ago, at which patient began regular hemodialysis. Documented proliferative retinopathy and diabetic neuropathy. Graft infection 3 months ago that was resolved after IV antibiotics. History of recurrent urinary tract infections. At this time, she has no history of injuries or trauma. Her current diet is a renal diet with 1,500 milliliter daily food restriction. And for her social history, her high school math teacher, she's a current high school math teacher, though she has not worked since she started dialysis a year ago. She's married with 1 son, Henry, age 8, and is in good health. Patient states that she has lost most of her friends since becoming ill, but she does have one close friend from whom she sees weekly. For her integumentum, her skin is flushed with good elasticity. Patient reports AV graft to be without tenderness, drainage, or recent color change. Skin otherwise is intact with no issues. For her head, ears, eyes, nose, and throat, patient denies changes in vision or hearing, denies nasal drainage or throat pain. Her pupil dilates at 3 milliliters and is brisk. Cardiovascular system, patient currently denies chest pain or palpitations. She has non-pitting edema in the lower leg. For her hand, capillary refills is less than 3 seconds. However, for her feet capillary refills, they are greater than 3 seconds. She is currently on tele. She has bilateral radial pulses at 2+, which are expected, and bilateral dorsalis pedis at 1+, which are thready and weak. Gastrointestinal system, patient reports recent weight gain of 10 pounds over the past few weeks, reports decreased appetite and decreased intake, denies abdominal pain, denies changes in bowel habits. Her abdomen is flat with active bowel sounds in all 4 quads, and her stool is formed in brown. Musculoskeletal system, patient denies any muscle or joint pain and recent changes in strength or range of motion. She has ROM in all of her extremities and has mild weakness while she walks. Developmental system, the patient reports the AV graft to be without tenderness, drainage, or recent color change. Skin otherwise is intact with no issues. Genitalia, patient denies recent changes in genitalia. Respiratory system, patient denies shortness of breath or pain with breathing or recent colds. Reports quitting smoking 2 years ago. She does have a productive cough that's clear, and it's scant and clear as well with the sputum that she does have. For her genitourinary system, patient reports recent decrease in frequency of urination and volume of urine. Urine has recently become more concentrated and darker in color. She denies pain, burning, or difficulty with urination. The urine is currently cloudy and amber right now, though, and she does have difficulty voiding. Neurological system, she is cooperative, and she does report some numbness and tingling in her lower legs. Endocrine system, patient reports documented diabetes mellitus type 1 since age 8, reports elevated blood glucose readings over the past few days, states that her unusual dosage of insulin do not seem to be controlling her blood glucose well. Lymphatic system, patient denies recent swollen or tender lymph nodes. The current medications that she's on right now is calcium carbonate, renal multivitamins, aspirin, clonidine, aspart insulin, glargine, erythropoietin, and atorvastatin. She currently does not know if she had any contagious diseases, but she does not have any known recent exposures either. Her previous surgery was, again, a left forearm AV graft, surgically created 11 months ago with no complications, and tonsillectomy at the age of 10. This patient is scheduled for medication impenem slastatin, which is also known as Premaxin, that will be due soon.
Thank you so much for giving me that report. Do you mind if I ask you a couple of questions regarding medication administration and watch you demonstrate giving the medication in the patient's room?
No problem. What questions do you have?
Why specifically is the client receiving this medication? And what action does the medication have on the body?
Well, it's an anti-infective which treats infections. It binds to the cell wall, thus killing it. The combination prevents renal inactivation of the imipenem, resulting in high urinary concentrations. Imipenem resists the actions of many enzymes that degrade most other penicillins and penicillin-like anti-infectives.
When should you question administering this medication? Does the medication have a therapeutic serum level? Which vital signs must be monitored, and which physiological should be monitored when the medication is being given?
Well, you definitely need to get a specimen culture for sensitivity to the drug and to confirm that the patient does have an infection. You should need to check their CCR levels if they have renal impairment and base the dosage off of their levels. You would also need to assess the WBCs to verify that they do have an infection. And of course, vital signs with the temperature, which also confirms an infection. Check their blood pressure, their pulse, to make sure that they're not receiving too much fluids, because with this medication we would have to give some fluids as well.
What are the side effects and potential adverse reactions?
Well, the main side effects would be diarrhea, nausea, vomiting, and rash. However, the severe adverse reactions we would need to look out for would be seizures, anaphylaxis, pseudomembranous colitis.
And how would you know that the medication is effective?
Well, we would see that the patient would have a reduced fever. They would also have a decreased WBC count, and you would have maybe verbal confirmation from the patient that they are feeling better.
Okay.
Any more questions for me before we go into administer the patient with their medication?
No, thank you so much for answering my questions.
You're welcome.
Go.
Hello. Hi, what's up, Connor? My name is Isabel. I will be your nurse for today. And this is Frankie. He's a student nurse.
Hello.
He's watching me.
Hey guys.
Okay, we do have some medication that needs to be given to you. We have some antibiotics, and we also have some sodium chloride, and that would be given to you simultaneously. The medication we have for you is imipenem and slastatin.
Okay.
Could you please tell me your name and date of birth?
Sure, it's Shanene O'Connor, and it was 1981, June 14th.
Okay, and do you have any drug allergies?
No, I don't.
Yes, you do.
Yeah, oh, I do actually. See, good thing we checked. I'm allergic to trithymoprim and sulfamethoxazole.
Okay, very good, and that's what we have on file for you too as well. And
Okay.
what reactions do you have with that medication?
I just, breakout.
Rashes, okay. Alright, I'm gonna go ahead and assess your IV here, make sure it's working properly. Dressing is dry and intact, no erythema, no edema. Okay, so we're gonna go ahead and get our tubing here. And then we have our sodium chloride, normal saline, and sometimes the package will look like it's wet, but once you tear it apart and take it out, just make sure that there's no leakage or anything. And then you want to verify the drug, sodium chloride, 0.9% normal saline, sodium chloride 0.9% normal saline. And then you have 30 mLs per hour continuous, 30 mLs per hour continuous. All right. I took away my cart. Sorry. I'm going to go ahead and borrow this. Mr. Connor?
Okay. As long as we get it back.
Yes, I will make sure that your call light and your side table will be at your bedside. Well, you know what? Let me go ahead before I do that. Okay, and again, I'm sorry, could you please tell me your name and date of birth?
Sure. Shanana O'Connor, and June 14th, 1981.
Okay, and that's exactly as it says on the MAR as well. Go ahead and scan this. Wonderful. And then we'll go ahead and scan this medication. Wonderful. All right. So now that we have that scanned, we're going to go ahead and take care of this IV here. So you want to make sure it's clamped off. Once you pull this off, this tubing would be sterile, so you want to make sure it doesn't touch anything. Same goes with this right here. Once you uncap it, it's sterile, so make sure you don't touch anything with it. Puncture it. Then you want to make sure that you squeeze enough solution to go midway into the tubing. Okay. So we'll hang this up here so this way our hands will be free so we can go ahead and prime the tubing. Do its thing. And just let it run until it runs through and you get all the bubbles out.
Pause. You failed.
Okay. Go ahead and let it prime. Once you get all the bubbles out, go ahead and stop it. Oh, my gloves are getting stuck in it. Okay. There we go. And then I'm going to take my alcohol swab. I'm just going to clean this here for 15 seconds. Attach that. Make sure that's not clamped. patient, yes. Medical surgical, yes. Okay, and we're going to go ahead and put in the patient's number. We have 8247823. Confirm. Not for human use. Then we do channel A. Select channel. Okay, so do guardrails IV fluids. And then we have 09 normal saline here. And that's yes. The rate would be 30 mLs per hour. And then how many mLs are in the bag? We have here. And hit start. And then you want to check make sure you unclamp it. And then you want to make sure there's a few drops. That's weird noise it's making. There it goes. It's a very slow first drop.
Go.
Thank you so much for demonstrating a safe medication administration. I have a couple more questions for you, if you don't mind.
Sure.
Were there any pertinent pieces of information that you reviewed before before giving the medication to the client?
Yes, I would need to review, verify the name, date of birth, allergies to any medication, and you want to check the IV site to make sure it's working properly, it's not inflamed, no edema, erythema.
Did this information affect the decision to administer the medication?
Yes, because you want to make sure you have the correct patient and the IV site's okay. Because if you don't have the correct patient and you don't have the IV site, then it would not be good to continue with administering the medication.
And did this information, did it affect how you administered the medication?
It could, in our situation with the patient, no, because the IV was impeccable. However, if the IV site was inflamed or the IV wasn't flushing, then we would have to pause or delay giving the medication to perform another IV site to give her.
Thank you so much for answering all of my questions. I really feel like I understand this so much better now.
Again, not a problem at all. I'm always here if you have any questions or need anything. I'm going to take some time now and document the teaching I provided to the patient, any other things that I did in the patient's room. Do you want to observe me documenting as well?
Sure, I'd love to.